Hi, I'm Dr. David Smotrich. I'm the founder and medical director of La Jolla IVF. Now I would like to talk about same-sex couples and the LGBT community. I've been very fortunate to be taking care of same-sex couples for all 20 years that I've been in our community. For male-male couples, I actually was the very first doctor ever to do a male-male couple back in 1997, and that child is already 17 years old. In that case, we got eggs from an egg donor, created embryos from one of the gentleman's sperm, and put the embryos into a surrogate, and the surrogate got pregnant and had a healthy child. With that particular case, we changed the law in the state of California to allow for two gentlemen to be on the birth certificate. So that unique pioneering case actually was my first case with a male-male couple, and I was the doctor who performed the case, and that case took place 18 years ago, and the birth was 17 years ago. Since then, we've been very fortunate to take care of male-male couples from all over the world. And to this day, I think we've done close to 800 cases of male-male couples from all over the world. In evaluation with a male-male couple, we go through the health history, as I had done in different videos. We review egg donation, we review surrogacy, we review pre-implantation genetic screening, we review the blood testing that is done by the FDA and required by the FDA, the history and physical exam that is required by the FDA, but most importantly, I talk to the gentleman to see exactly what they want. Overwhelming majority of the cases of male-male couples that I do, both gentlemen would like to be involved in the case. So in that situation, we have an egg donor, and we try and get a prolific egg donor so that we have a large yield of eggs. So let's say that we're using donor Susie, and donor Susie does very, very well, and she gives us 20 eggs. And let's say we have two gentlemen, gentleman A and gentleman B. We split Susie's eggs, and we give 10 eggs for gentleman A and 10 eggs for gentleman B. And now we follow very carefully in the laboratory how many of the eggs fertilize for each gentleman, as well as how the embryos are growing and developing for each gentleman. We like to grow embryos to the 5th day here, which is called blastocyst. On the 5th day, as I had explained in another video, we have the ability to do pre-implantation genetic screening of the embryo, and then we know the sex of the embryo and know that the embryo is healthy. So let's say that each gentleman wants to be involved, and gentleman A has 2 embryos, a male and a female, and gentleman B has 2 embryos as well, a male and a female. And let's say they had their hearts set on 2 males. So we can take 1 embryo from gentleman A and 1 embryo from gentleman B, combine them, and place both embryos into the surrogate. And this will maximize their chances of having a successful pregnancy and maximize their chances for having twins. In our hands, using a good quality egg donor, and using genetic screening of embryos into a good quality surrogate, we have close to a 90% pregnancy rate, placing 2 embryos, again 1 from each gentleman, with about a 55 to 60% chance of twins. So this is how we maximize both gentlemen to be involved. In 2005, the United States federal government, or FDA, got involved in all cases with regards to egg donation, surrogacy, and intended parents placing their tissues into a surrogate. So in addition to a history and physical exam, for the sperm giver, we have to do blood work and urine testing for HIV, hepatitis B and C, HTLV1, syphilis, gonorrhea, chlamydia, West Nile virus, which has to be done initially and within 7 days of the gentleman giving sperm that can be used for a procedure. In a situation where a gentleman's blood and urine testing comes back positive for an active infection, for example, active infection with chlamydia or gonorrhea, or an active infection of cytomegalovirus or syphilis, we have to discard that gentleman's sperm. But all hope is not lost. We can treat the gentleman with antibiotics and wait, and once the gentleman has been successfully treated for whatever infection it is, we can have him come back and give us another sperm sample a sperm sample done within the guidelines of the FDA, within the 7-day period, that the blood and urine testing shows that that sperm was not infected with any infection, and then we could indeed use that sperm in a surrogate case.